in adults. Okay, so the number one recommendation is going to be the use of non-tobacco. Tobacco products are likely to cause a strain on heart vessels, a strain on the arteries and the veins, causing constriction, which causes the blood flow to build resistance and have less fluidity when trying to bring oxygen to organ systems and so forth. So tobacco products is a known fact that they do cause risk of heart attack. When you go for a screening, health screening, usually the healthcare provider or professional is going to ask you, number one, how much tobacco products do you use? Do you use 2 packs of cigarettes per day, 1 pack of cigarettes per day? They're going to want to know that information to get an overall understanding of your health. So that's going to be number one. Number two is that you should maintain a exercise regimen. Cardiovascular exercise is great. It gets your heart rate up, it gets your blood flowing, it gets energy going, gets your organ systems going as well. This is good for recommended by the American Heart Association and the American College of Cardiology. Exercise 150 minutes per day, or you can break it down to easily 30 minutes per day or 150 minutes per week. And that will give you a great energy boost. It'll give you a great opportunity to maintain energy and stay focused as well. And it helps your heart to pump and also load the amount of blood for oxygenation. And it gets your kidneys working as well. So we know the heart and the kidneys, they both work together to reduce waste and to help the body maintain proper momentum. Okay. Now, the third suggestion that healthcare providers do want to make sure that patients know is that they should eat a diet that is rich in fish. A diet that is rich in fish and consists of a special type of oil. We call it omega-3 oil. This omega-3 oil fatty acid product is great for the heart protection in humans. And it's great because it helps protect the blood vessels as well. And it's a healthy choice besides eating red meats and porks and things of that nature. We recommend fish products instead. As much, if you can eat fish once a day, that'd be great. Or if you can eat a certain amount of ounces per day, that'd be great as well. But the more fish you eat, the more oil that comes out of the fish, such as mackerel, for example, is a type of fish that has a good oil base in its skin that allows protection for the human as well. So that's the third. The fourth item is to consume as least sodium as possible in one day. The recommendation by the American Heart Association is 1,200 to 1,500 grams of sodium per day. Less than that is even better. Okay, so the amount of sodium that is reduced in the diet will help you to maintain good fluidity and also helps to reduce the amount of fluid retention in the body. Okay, so we know that water follows sodium. Okay, so when you eat a lot of sodium, that sodium goes into your body and then your body wants to collect water. And that's not good. That's the opposite of exercise. We don't want the opposite of exercise. We want to get that fluid out of the body. And we want to do that the most natural way by reducing the amount of sodium products that we eat in a day, okay? And again, that's 1,200 to 1,500 grams of sodium per day, or less, even better. If you have risk of diabetes, history of family heart attack or infarction, a history of kidney disease in your family, you would be great to reduce the amount of sodium in each meal that you consume, okay? Last and finally, I want to recommend not only sodium reduction, not only exercise, not only fish consumption, omega-3, and then we have the also, I mentioned earlier, it was tobacco cessation. Okay. And then also, besides that, I want to say that's everything that I wanted to mention in this particular video. And I do have short YouTube short videos as well that have in Spanish and in English all the information listed out for you. Okay. Oh, saturated fats. Saturated fats are harmful fats, and examples of harmful fats are trans fats and saturated fats. These are false fats that are used by manufacturers to help preserve product meats, frozen goods, snacks like potato chips, things like that. They are sometimes filled with lots of trans fats or saturated fats. So read your nutritional label before purchasing and eating these items. So that'll be good for you as well. So I'm glad that I was able to mention these items for you. If you have any questions or concerns, please let me know. Again, I'm a pharmacist, pharmacista, since greater than 10, 12 years ago. I received my degree and license, and I want to share this information with you. Please like, share, and also don't forget to subscribe. Hope to see you on my next video. Nos vemos. Ciao.